Meth contamination forced 6 libraries in Colorado to close over the past few months. Now, all of them have since reopened.
But these closures cost you and other taxpayers hundreds of thousands of dollars. So we're asking, did communities really need to close these libraries?
That's a lot of money. Denver 7's Angelica Albaladeo did some digging to find out.
It started in the Boulder Public Library upstairs bathroom.
I was disturbed by the fact that people had chosen to smoke drugs in the bathroom. That was disturbing to me.
The library shut its doors for 3 weeks to test and clean up methamphetamine contamination. An unpopular decision with regular visitors.
I think my first reaction was it was both sad and probably fair.
Boulder was the first to close, but other libraries soon followed. Inglewood, Littleton, Arvada, Colorado Springs, and Pueblo. Each time a library closed, a domino effect. Hazmat called in, expensive cleaning started, some furniture ripped out, bathrooms sealed off. But several health officials we talked with say it didn't need to go that far.
The risk is much, much lower, clearly, when it's a secondary exposure.
Ann Sasheen Williams is a top manager at Denver's public health department. She says Denver takes these concerns seriously, but there isn't any danger.
You're not going to have any symptoms. You're not going to have any effects from that. You're not metabolizing it. You're not smoking it.
Hearing that, we wanted to find out what was behind the decisions to close. So we requested internal emails about those decisions. In the days following the Littleton Library's closure, city employees emailed each other to say there was no immediate danger and the health risks to employees and the public are considered low. In fact, Boulder acknowledged the same thing in a press release, saying there's no indication of significant health risks. So why close? Boulder's library director says he was just trying to follow the law.
I think we're obligated to follow state guidelines. We tested. Once you have tested, then the remediation is not something that's negotiable.
But legal experts we talked to say that law is meant for home meth labs, aimed at protecting children exposed to toxic levels of the drug.
Residential exposure is very, very different than you're going to get in a public space, especially in a space like a bathroom.
Mike Van Dyke with the Colorado School of Public Health helped Colorado set its threshold for meth contamination.
And from a scientific and a risk perspective, that threshold is not appropriate for public spaces.
That's why some libraries have stayed open.
We will continue to lean on science and data to inform our decision, and we're just really happy that we're in a place where we can continue to keep our buildings open.
Erica Martinez runs community engagement for the Denver Public Library System. She wants Denver residents to know it's safe to go to their local library.
For us, it is really important, one, to ensure that our buildings are safe for people, but that we continue to offer those critical services that people look to us for.
Services like computer access to apply for jobs or study for the GED. For others, libraries are a kind of safe haven, a comfortable place to meet friends or just enjoy a good book.
It was sad to not be able to come here. This is a haven for all of Boulder.
Boulder has reopened its library, but its bathrooms are still closed, and benches they feared were contaminated have been ripped out.
It's a different feeling.
All of the libraries that closed across the state have since reopened. Boulder reopened its main library in late January, but bathrooms are still closed for a cleanup process that's cost more than $150,000. Testing and cleanup at other libraries has also cost tens of thousands of dollars. Denver 7 will continue investigating why libraries started using Colorado's law on meth cleanup in this new and costly way, and if lawmakers are considering changes. I'm Angelica Albaladeo, Denver 7.